Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Sandra Carpenter, who is a board-certified, full-time classical homeopathic practitioner and the owner of Source Healing Homeopathy. So years ago, Sandy was introduced to homeopathy as she was searching for a more holistic approach to help her 2 sons. And in 2017, after a 25-plus year career as a civil engineer, she realized that homeopathy was a career she wanted to pursue, so she did the one thing she said she would never do. She went back to school. In the spring of 2021, she completed her 4-year professional homeopathic practitioner training. And that same year, she ended her engineering career and focused on her homeopathy practice full-time. Sandy knows without a doubt that homeopathy saved her family from a life dependent on medications. Her favorite quote is from Charles Rappel, who wrote, "Take the I out of illness, add we, and you have wellness." I love that. She believes strongly in working in partnership with her clients as they take control of their overall wellness and vitality, and she works with clients as young as infants all the way to elderly and everyone in between. She also has a personal interest in working with emergency first responders like law enforcement, fire dispatchers, veterans, and their families. Sandy lives in Appleton, Wisconsin with her husband Ryan and their 2 dogs, Lily and Maddox. And for this series, we recommend listening to it in order, as Sandy provides insight into what homeopathy is and how it works in episode 1, then everything you need to know about homeopathic remedies in episode 2, using homeopathy in everyday life in episode 3, and then finally raising kids with a homeopathic approach in episode 4. So the episodes do kind of build upon each other. We loved learning from Sandy, and we know that you will too, so let's dive into today's conversation. Hey everyone, welcome back. We're at episode 3 out of 4 of this 4-part series with Sandy, and we're excited today because this is going to be a fantastic episode. We're going to be basically taking everything we've learned from episodes 1 and 2, which has been super informational and educational, and we're going to be bringing it into using homeopathy in everyday life. So first question is, how do people typically approach homeopathy? Are they thinking long-term use? Are they thinking short-term use? Something like, I have a little bit of a cold?
It can, I get the question a lot of, can homeopathy help with this? Homeopathy help with that? And my answer is yes. It's not used to treat any one specific illness or disease or diagnosis. Homeopathy is used to support and treat the person's specific symptom state.
That's important to know.
That is very important to know.
Yeah.
So there's 3 different ways, I guess I'll call them categories, of working with homeopathy and working with a homeopath. The first one is acute care. Acute care, think of those things that come on sudden. You wake up with a sore throat, or, one of your kids wakes up throwing up in the middle of the night, or an injury. Your kids are outside playing and someone falls and, bashes their knee or, bumps their head or something like that. So there are things that come on suddenly that aren't part of your everyday life. The occasional headache. If someone suffers from headache symptoms regularly, that's going to fall in a different category of care that I'll touch on. But if it's an occasional headache, symptoms from headache, then yeah, homeopathy can absolutely help with that. So you want to take a look at the specific nature of what someone is experiencing. How does the pain feel specifically? And then you match a homeopathic remedy to that. Usually homeopathic care can reduce the duration of an acute which normally is like a 7 to 10 day, down to 3 to 5 days.
Wow.
That's amazing. I mean, talk about quality of life.
Yeah. Well, can we talk about acute, chronic? What's the differences with all those?
Right. So acute, think of it as something that comes on suddenly, it has its life, and then it has an end. And then the end is either going to be your symptoms are going to go away or it's going to kill you. It's like that's an acute situation. You die from it. Um, Chronic, which is also considered constitutional, we refer to that as constitutional. Constitutional care is looking at the totality of someone, and it's to address those symptoms that have kind of become part of your everyday life. Examples of that could be symptoms from anxiety, depression, behavioral, ADD, ADHD, respiratory, irritable bowel, other gastrointestinal, musculoskeletal, anything that has kind of become part of your everyday being that you are experiencing on a daily basis, like headaches. People who do experience headache symptoms on a regular basis would fall under constitutional care.
Yeah. And then you had mentioned, at some other point too, is like focused care too. Like, because that's not just, we have acute, we have chronic, but then you talked about, or you were telling me about focused care. Can you talk about that too?
Yeah, focus care is kind of that in between acute and constitutional. So types of, when I say focus care, are homeopathic support after surgeries, post-surgical, homeopathic support after childbirth, so the postpartum, homeopathic support during rehab, someone who maybe is rehabbing from an energy or an injury, or maybe they had a knee replacement or hip replacement or something. So they're having to go through a longer process in their healing to kind of get back, and it's more injury related. So when I work with people in that focus care, we kind of come up with a plan of, okay, what remedies do I want you to take? Like the day, let's just use surgery as an example, the day of surgery, the day after surgery. And then we do a check-in, like on the day 3, and then see, okay, how are your symptoms? How are you feeling? Where do you need some more support? And then we build on it from there. I might change up the remedies depending upon what they're experiencing. Everybody's pain is different. Same thing with postpartum. Everyone goes through postpartum differently, right?
I have a question on like those focus care. So let's just talk about postpartum because there's going to be a lot of moms listening to this podcast. So when somebody comes to you and say, "Hey, I'm going to be having a baby, I would like to get proactive with this," and they get like a postpartum, would this be like a kit too, like kind of in that mindset, or
We could develop a kit. Yeah,
Okay.
there's a kit. And that kit is usually about 12 of the most common remedies that someone would likely need within the first 3 to 4 days after.
And I know we're not treating anything. Are we anticipating the symptoms of postpartum, or how does that work? Like, what are you really
So for
prepping
something
for?
like postpartum, I mean, there's some very common symptoms that women will go through. Sometime it's, something as simple as urine retention. That can happen immediately after childbirth, or sometimes it has to do symptoms from hemorrhoids or the pains of healing, or if someone had a C-section, right? The recovery after having to go through the C-section, the healing that needs to happen, and whatnot. So there's very common symptoms that women will experience after that. And like the bleeding, right? The bleeding that can continue. So there's some very common remedies that fit sort of that generalized state that women go through in postpartum. So that's what would be in the kit are like the most common remedies. So they would have that on hand.
Kind of like that anticipation.
And right. They might not need all of them. They might
Right.
only use 2 of them,
Right.
but our quote unquote plan would say, okay, I know you're going to have a lot of bleeding after
Yeah.
you gave birth, and arnica is your first go-to, for something like that. So that's a real easy one to tell people about, and then there's always going to be continued care when you're working with a homeopath. So I don't just give my clients this focused care kit and say, okay, good luck.
Good luck. Yeah, good
Yeah.
luck with that.
So
yeah.
there's always a check-in, via email or a phone call that happens like the day after, 2 days later, so we can track how they're responding to the remedy. And then we can switch to a different remedy if we need to.
So that was a question I had as you're talking about this, is in the prior episode, we talked about different types of remedies and we talked about combination. So in an instance of like surgery or postpartum, is this an instance when you would have them taking more than one remedy? And like, would one remedy be more for bleeding and one would be also for inflammation? And like, would you have them taking more than one remedy on a focused care plan?
Not at the same time. So there may be a situation where I might have them alternate the remedy. A good example is another very common remedy is hypericum, which is known for like intense nervy pain. So if someone is postpartum and there was a lot of trauma to like maybe their coccyx or, something that has in that cluster of nerves, I may say, okay, I want you to take hypericum, but then I also want you to take arnica, but here's how I want you to alternate it. But those are very unique, specific situations where I would recommend doing that because remedies aren't just for one thing. They cover so many different parts of our physical body and our mental, emotional as well, too. So I don't want to encourage people to be like, oh, I can just keep alternating these. But there are specific times where that is warranted. But that's where it's important to maybe, check in and talk with a homeopath.
Yeah, that I like the focused care is extra interesting because it's like you said, it's kind of in the middle. It's not that this will be over with in 7 days, and it's also not this
Lasting
is something I'm
forever.
struggling
Yeah.
with for a long time. It's just kind of okay, this is typically pre-planned. We know what's coming, but it's going to be a longer recovery. So that's really interesting.
And I think it's an area that a lot of people don't think about.
Yeah, I didn't really think about that.
Because even going through schooling, we focused on acute, focused on constitutional, chronic, and it's just an area that a lot of people don't think about. Oh, I can still receive homeopathic help. I tell people all the time, if I break my leg, I'm going to an awesome orthopedic surgeon who's going to put my leg back together. And then I'm going to turn to homeopathy to support myself in the healing process.
Okay. What about something like allergies? Like that kind of falls somewhere in there they can last a whole season, but they can also go away during other seasons. So are there homeopathic remedies for allergies?
There are homeopathic remedies to cover allergy symptoms. So if that is something that someone suffers on a regular basis, and even if it is seasonal, the fact that it's seasonal, like maybe it only occurs in the springtime for someone, or maybe it only occurs in the fall for someone, that's an indication. That's another piece of the specific nature of that person's symptom. Dealing with the susceptibilities of allergies, that is more of a constitutional. And so when you're on constitutional care, you're likely on a remedy that you might be taking every day as a very, very soft, supportive to your vital force. And that's building your vitality. That's building your resiliency, which is going to reduce your susceptibilities to things like, the change of the season, if that affects you. So over time, you will have less and less of a response to those things that trigger your susceptibilities. You bring up allergies, and that was the thing that brought my husband to homeopathy, was he had dealt with horrific allergies his entire life. He was on 3 different medications and then dealing with all the side effects of the medications. And, they really weren't working well, for him. And he started working with our homeopath. And within 1 year's time, he wasn't experiencing allergy symptoms the following season.
Wow, that's incredible.
There are times, though, that those symptoms have come back in a way that has proven and shown just how important, like, the supporting of your vital forces. I give this example, and I've been given permission to give this example. He's in law enforcement. And he had been on homeopathic care for about 5 years, not having allergy symptoms after dealing with them his entire life. And he had to respond to a particularly tragic fatality accident. And it was in January, so cold, rainy, icy here. And the next morning when he woke up, he had quote unquote full blown allergy symptoms in January, which there'd be no reason from a physical standpoint. But that instance of dealing with that traumatic fatality, even though he's trained, even though he's done it many times, it still impacted his vital force in a way that caused this to have sort of a response within him. His vital force needed some help because something impacted him on a mental, emotional level. And that's an important thing when we talk with clients, even if it's an acute. I'm going to ask, how's your child's mood? How are they acting now that they're sick? Maybe your child is the most happy-go-lucky, and when they get sick, they become this very irritable bear.
Yeah.
They have this response that's not only physical, but it's also on the mental, emotional.
Wow, that's really interesting.
Yeah, and Sandy was mentioning vital force. If you did not already listen to episode 1 of this series, that's where she talked about vital force. It's really interesting. Make sure you go back and listen to that episode. So one other question is, at what point are traditional medicines needed? So if you're working with someone and let's just say it's a chronic challenge that they're having and you've tried multiple different homeopathic remedies, have you ever had an instance where you're like, you know what, I think you should try this, like maybe talk to your doctor about an actual medication, or have you never experienced that? Are there any times that actual medications are needed?
Well, there's always going to be times where medications are needed. There's always going to be emergent situations where, a medication is probably life-saving for someone. I have not worked with anyone in a constitutional chronic that actually hasn't already been on a medication, and they're looking to maybe want to get off that medication. One of the things that we do and is at the focus of our work as a homeopath is we're always observing and wanting to know, okay, what is the vital force saying back to us, right? We give a remedy. What is our response? We give a remedy. What is the response? It's not uncommon when you're working with someone who's on a medication. I can give an example. I was working with someone, they had been on high blood pressure medication, and we were working constitutionally. After about 9 months, they came to me for their follow-up, and they were experiencing some very unusual symptoms for what, we had ever been working on. And in knowing that they were on, medication ABC, I looked into medication ABC, and it was what they were describing to me was a very common side effect of the medication. So my role as a homeopath, because I'm not a medical doctor, is to tell my client, you need to go back to your doctor. You need to tell your doctor about these symptoms and then report back to me. Well, he went back to the doctor, and the doctor reduced the amount of the medication that he was taking. He didn't need as much anymore because he was having his vitality was improving, his resiliency was improving with homeopathic care, which meant that susceptibility was going down, and his body didn't need as much of that medication. So that's where my role is. If something is emergent, I'm going to tell. I mean, I've had people call me and I said, you need to go to urgent care right now. That's
Take care of the problem.
Right.
And once that is like
Correct.
over with,
Correct.
we can talk.
Correct. Someone called me, they were in the middle of having heart palpitations, and they had a history. You need to go to the ER right now.
For sure. Yeah. I mean, a broken leg,
Right.
You need to have that, make sure that it's
maybe
in the right position, and then
pain
let me help you
management
recover.
immediately.
Correct.
Yes.
Correct. And then we'll work together.
Yeah.
So I do want to touch just on a couple of really common symptoms that people do experience. What about like muscle fatigue and soreness for someone who maybe is working out and they experience extra long soreness, lots of soreness, or maybe they work in a job that they're having a lot of muscle soreness? Can homeopathy help them?
It absolutely can. What is interesting with muscle soreness, again, it would need to have a conversation of, okay, well, what do you mean by sore? What makes it better? What makes it worse? Does it always happen when you are having this particular movement? Or is it only when you're working out? And when you feel this soreness, what what is your overall mood when you feel this soreness? Is it irritable? Are you weepy? Are you angry? Are you indifferent to it? So there's a handful of pretty common remedies that would probably be indicated, but again, it goes back down to the what are your specific symptoms. Some very quick and easy over the counter product that people can try for muscle soreness, and a lot of people do, is it's arnica gel or arnica ointment. I think a lot of people have seen that. I think you can even get that at Walgreens or CVS. That's been very beneficial for people. But again, it's a very, very low potency, and it's topical. So it might help for a little bit and then stop helping.
What about, do people ever take a homeopathic remedy as an ongoing, almost like a vitamin, like almost like a support piece? So if you're talking about muscle soreness specifically, this is where the question kind of came from, as like, oh, I just did a really good workout, I'm going to use it as like a supplement. Do people ever do that, or is that cautioned against?
It depends upon the situation. So I have worked with some young athletes, high school athletes, and they have had some situations where because of the repetitive nature of what their sport is, particularly volleyball, and they were having a very particular type of soreness and pain because they would go play, 5 games in a tournament in a day and do
Same
another
movement,
5.
same doing the
Correct.
same things. Yeah.
So then there would be a lot of times that I would have them try, it's called Ruda, but in a very low potency 6C, but only for those times, right? If you are not experiencing symptoms, do not take a homeopathic remedy. There's no need. It's only if you are experiencing symptoms.
Well, it's really interesting. I'm sitting here and my brain has to get wrapped around the thought process of homeopath. And like normally you go to the doctor and you go there and you're like, hey, this is my problem. And they say, hey, this is your diagnosis, right? So when somebody comes to you, it's almost like, for one thing, they have to be ready to answer very detailed questions about everything that they didn't even think they knew. So, and very descriptive, which is great. I think that the more the better, right, for you. But then it's almost just like they should come to you and don't give you a diagnosis. You just need to know their symptoms.
Correct.
Right? Because that's what you're treating. You're treating symptoms. You're not treating a diagnosis.
Correct. If they have a diagnosis,
right,
that's more information for me
that's
to
more
have.
information, but it's just like,
I'm more concerned and I want to know, okay, but what does this feel like? What is this like for you?
yeah, it's just getting your brain wrapped around that a little bit. It's different than how we traditionally think, So
So if someone were to come to you with, whether it's an acute challenge, what was the one for surgeries? What do you call that one?
Focused care.
Focused care, thank you. Or a chronic challenge that they're going through, what does that look like to work with you? How often are they meeting with you? So let's start with acute. So I'm getting cold symptoms or something else, maybe a common example you could give. What does that look like to actually work with you?
So the first thing someone would do is, contact me, either email me or, call me on the phone. And then I send someone, it's called an acute care questionnaire. It's got a bunch of questions to elicit exactly what you're saying, Drea, is like, okay, what does this feel like for you? And when did this come on? And what is your mood like? And then they send that back to me. 99% of the time I need to go back and then we set up a telehealth call, for most, that works most of the time. Sometimes it has to just be a phone call, but I'll set up a time and we'll do a telehealth link video call. And then I can ask some further detailed questions. Then I will come up with a remedy recommendation. I'll ask them, okay, where do you live? What's near you? To see if I can think of a store that I know might have homeopathic remedies. For an acute care, you're going to take the remedy more often. Usually I'm saying, okay, I want you to take it, every 3 to 4 hours for the next, 24 hours or 4 doses. Then I want you to send me an update. because I want to know what has changed, what hasn't changed, what is your vital force saying back. And then I'll get an email update, tell me, yep, this has changed, this hasn't changed. If nothing changes, then we move on to the next remedy. Most of the time something has changed. So then we stick with the remedy. I'm said, okay, this is how I want you to take it for the next 24, 48 hours, and then send me an update. So an acute care consultation with most homeopaths, there's the initial fee of the initial consultation, but it also includes somewhere from 3 to 4 days after that of communication with you so that we can track how are you responding and what's happening. It isn't just a here, take this.
Yeah. Oh, for sure.
And then
Yeah.
pay for the follow-ups, right? It's all included.
It's all
Yeah,
included
that's
in
great.
that.
Okay, what about focus care? So let's pretend I'm pregnant and I'm going to have a baby in a month and I want to contact you and I want to be prepared for my postpartum care. So what do the touch points look like in that process?
We would meet, again, it could be telehealth or meet in person. I need a little bit of information. Is this your first pregnancy? Is it not your first pregnancy? What are some concerns? What is your history with homeopathy? What do you know about homeopathy?
Yeah.
So there's a lot of education that I end up doing. And then I'll tell them about the kit that I think that they should have on hand. And then I email them sort of, okay, this is what I want you to take on day one. Have someone send me an email giving me an update on how you are, after day one and then on day two. And so it's usually just like, here's what I want you to do for the first few days. But again, we're going to have that same check-in and then we take it from there. And then some time might go by, maybe 4 weeks later, something is still lingering. And then they call me back and then we can take it from there.
How about chronic? You're working with someone long-term. So what do touch points look like for that?
Chronic, your initial consultation is going to be 2 hours in length. I have my clients fill out a pretty extensive health history form, and then we meet and we talk, much like we do with all the other ones. But it's me understanding everything we possibly can about what is it like to be you living the life that you're living. If I'm working with a child on a constitutional level, a lot of the conversation is about mom's pregnancy. What was mom's life like right before getting pregnant? Was there any big thing that happened during pregnancy? Maybe they moved across country, maybe, who knows, change jobs, some big event that really sticks out to them. What was the birth like? What were they like as an infant, like the child like as an infant? So mom's state is a big piece of when we're working with kids on a constitutional level. And then after that 2-hour consultation, I do my analysis and clients hear back from me usually 7 to 10 days later. And I have a remedy sent to them from the homeopathic pharmacy. Because when you're working with someone on a constitutional level, you're going to need higher potencies that aren't available over the counter. And that gets sent to them and I give them dosing instructions. And then we meet again 4 weeks later. So with a chronic constitutional, we need to give it longer time to really see the overall effect of what the remedy was. Because if someone's wants to work homeopathically with a chronic, they've been dealing with something for quite a while.
Yeah, it's going to take a long time to unravel.
It's not going to take 3 to 5 days.
Yeah. And I feel like it's such a benefit that you can meet with people virtually too. Because not only can you work with people from all over, but also people can be in the comfort of their own homes. And it's a conversation. It's wonderful that you're able to offer that. Okay, well, this was an awesome conversation. Make sure you stay tuned for the next episode because we're going to be talking about raising kids with a homeopathic approach. So kind of taking what we took today and bringing it more toward kids and pediatrics specifically. And I think you're going to love that episode. But before we go, I want to let y'all know that Sandy is offering $10 off an acute care consultation and 10% off a home remedy kit to any listeners. All you have to do is just reference the Motherhood Alliance podcast when you contact her, and you can get those deals by being a Motherhood Alliance podcast listener. And like we said, if you're not near Appleton, Wisconsin, where she does the in-person visits, you can also work with her virtually. So that's awesome. How can people connect with you?
You can find me on my website, sourcehealinghome.com. I'm also on Facebook and Instagram, but if you go to my website, that's probably the easiest way to get a hold of me. You can message me through my website or my email address is on there too. That's
Perfect.
great.
Yeah, that's great. All right. Well, thanks for joining us, Sandy.
Thank you so much.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.